Welcome to TOSB Conversation Starters. I'm your host Shreya Pilani, and today's conversation we are delving into this fascinating world of genomics. You've probably heard about DNA being the hereditary material in humans and almost all other organisms. But did you know that DNA also holds the power to predict your health? Imagine this. Within our genes lies a blueprint, a complex code that holds the secrets of our origin as well as the future of our health. That's our DNA. We'll explore this and more today with our esteemed guest, Dr. Suruchi Aggarwal, Head of Scientific Affairs at MedGenome, a leading global genetics, diagnostics, and research company working at the cutting edge of genomics led research and innovation. With over 11 years of experience and a PhD in human genomics, Dr. Suruchi is a pivotal figure in cancer genomics, driving advancements in personalized medicine. Wow, that's some introduction. Welcome to the podcast, Dr. Suruchi.
Thank you, Shreya. Thank you for the kind introduction.
It's a pleasure to have you here. And this is first of a kind that we are doing at TOSB Conversation Starters. So we are all very excited, and I'm sure so are our listeners. So diving straight into the first question, what factors, in your opinion, are driving the growing interest in preventive healthcare, particularly in the aftermath of the COVID-19 pandemic?
So, healthcare awareness especially has gained importance over the years due to various factors which leads to healthcare landscape in India. And more importantly, like rising burden of non-communicable diseases like diabetes, cardiovascular diseases, cancer, respiratory disorders. These are some of the diseases which increase the health burden of non-communicable diseases in India, and it leads to rise in the awareness for preventive healthcare mechanism. So,
Mhm.
preventive healthcare measures are important to find out the risk factors associated with these diseases. For example, maintaining a good lifestyle or going for regular health checkups. COVID pandemic has highlighted the importance of maintaining good health and immunity to prevent the spread of infections. And this awareness has definitely led to the adoption of healthier lifestyles and prioritized preventive measures. Preventive healthcare focuses on reducing the overall incidences that we need to understand that it focuses on reducing the overall incidences of the diseases. That means it promotes overall health and wellness. The measures like vaccinations or health screenings or diet and exercise or health education, these are all the part of preventive health measures.
That's very interesting. So, Dr. Saruchi, I've also, heard this term called predictive healthcare. So while, we've heard it, we probably don't know the science behind it. So when we discuss preventive versus predictive healthcare, how do you differentiate between the two approaches, and what role does each play promoting women's health?
Yeah, so that's very interesting to know because these two terms they lead to the better health outcomes, but they have different perspectives. For example, as I mentioned, preventive healthcare focuses on overall health and wellness, whereas predictive healthcare focuses on identifying the individuals at risk of developing certain diseases or a health condition, which is based on their family histories or some risk assessment tools or some various health tests they would have undergone, or data analytics, for example, uh, the risk factor for a cancer or a cardiovascular disease which prevails in the family, and we want to identify a particular individual at risk. So that is basically predictive healthcare. So both of these preventive and predictive healthcares are important and go hand in hand. Preventive healthcare focuses on promoting overall health and wellnesses using various health promotion programs, or individuals are going for regular health screenings, or government is uh, providing the initiatives for health promotions and some public health programs. Whereas
Mhm.
predictive healthcare is majorly focusing on the individual at risk, and individuals who are at risk of developing certain diseases can go for a specific health checkup so that their risk can be identified. For example, if there is a multiple members in the family or one or more than members in the family who are having a cancer, so unaffected family member can go for the genetic testing to understand their risk of developing cancer. For example, here in the family, women is carrying a mutation in a gene called as BRCA, and this gene predisposes the women to develop breast or ovarian cancer. So if there are unaffected women of the same age in the family, as a predictive health measure, they can go for a genetic test and understand their risk, which will help them to prevent the cancer early development of the cancer, and also the financial and physical emotional burden of treating the disease reduces when you detect the diseases like cancer early. So these are some of the benefits of predictive healthcare. Similarly, predictive healthcare holds importance for the families who have a history of cardiovascular diseases, hypertension, diabetes. They can go on for a specific tests to understand their risk. And the screenings, health screenings is basically preventive health measures where people can undergo certain screening programs to understand their risk of diseases, which does not require any prescription or does not require any data analytics or any family histories or anything. But if a individual is aware that they want to undergo certain health screening programs, they can go for such screenings. For example, breast scan after 40 years of age for a woman becomes important every 2 years to get them screened if they are having any symptoms of cancer or not. So these programs, they come under preventive healthcare. And MedGenome provides predictive healthcare tests, genetic tests basically for diseases like diabetes, cardiovascular diseases, neurological disorders, your vision health, obesity, and also in reproductive genetics, which we may talk about in some time.
This is very informative, Dr. Suruchi. So, as a lay person, if I were to understand, then I can say that if I know that there is a family history of diabetes in my family, then instead of just praying that oh, I should not be diabetic, I should not test positive for diabetes, I can actually, if I have this predictive healthcare mechanism in place, I can actually act well in time. Is that what you're trying to say here?
Yes, yes, that is what, that you can have a informed decision about your health, and also you can be proactive in taking the measures that may elevate the risk of developing the disease which you are at risk so early. And you can maintain your lifestyle, you can be informed about your health, you can maintain your diet, lifestyle, and you can go for regular health checkups so that you are aware about your body basically. And that is very, very important, I feel, in these times, because once you develop the disease, it is very difficult. There is a lot of financial as well as emotional, physical burden for yourself, for family, and for healthcare system. So it becomes very important that if you are aware, it will be helpful for all.
Absolutely. And could you further explain the mechanics behind genetic testing and how it is contributing towards improving health and well-being?
Yeah. So in India, genetic testing has been made available at lower costs by labs like MedGenome in Bangalore, which are run by genomic experts, and they follow strict healthcare guidelines. Medical guidelines have recommended doing genetic testing in various situations. Like we discussed, like when there are one or more members of family with cancer, which comes under predictive healthcare. Also, it helps to understand the risk of developing certain diseases, like we discussed about cardiovascular diseases, and take early steps to prevent it. There are screening genetic tests also, if you are aware and if you want to have informed decisions about your health, you can undergo screening genetic tests that can be availed without family history or prescriptions. And MedGenome provides a lot of such screening tests for diabetes, obesity, just like we discussed earlier as well.
Mhm.
Not only this, genetic testing for a couple who are planning for a child plays a very important role for screening the parents if they are carrying any genetic change that may affect their child, especially when marriages are consanguineous or there is a family history of any diseases. For example, if parents are thalassemia minor or they carry thalassemia trait, they are carriers, there is 25% of chance that child will be affected with thalassemia major and may require blood transfusions for life.
Mhm.
So such tests, they help to understand, like carrier screening. We call it as carrier screening or carrier gen that we have at MedGenome, which helps us in understanding that how your developing baby or your future baby may have certain risk of developing certain diseases, which may you be just a carrier but not symptomatic at this point. During pregnancy, genetic testing on maternal blood, the technological advancement is now helped us to do the genetic testing on maternal blood, which is called as non-invasive prenatal test, which helps to understand the abnormal genetic changes in the developing baby, and therefore the counseling can be provided to the parents accordingly, whether to continue with the pregnancy or not. So these kind of tests, they are predictive healthcare, where if there is any abnormality or any doubts seen on ultrasound, non-invasive prenatal testing, even if it is not seen, still non-invasive prenatal testing is helpful for all the mothers, would-be mothers, to understand the genetic makeup of their child, whether any genetic disease is, if the child is predisposed to any chromosomal or genetic changes. So I just want to highlight here the importance of genetic counseling in all of these genetic tests that we are discussing about.
Mm-hmm.
That genetic counseling plays a very important role, and it is recommended. It is a must to be done for any individual who is undergoing the genetic testing. So it can be pre-test genetic counseling, where genome genetic counseling experts make them understand like what is the role of this genetic test, why this genetic test is done, what can be the outcomes of these genetic tests, and how it is done. And whatever you want to know about the genetic test, you can ask the genetic counselor expert during pre-test counseling. After the reports are there, the post-test genetic counseling helps to understand the results and the implications of the results on the individual as well as on the family. So both pre-test and post-test genetic counseling is available now in India with genomic experts, or I would call genetic counseling experts. And MedGenome actually provides free of cost with all the tests that is availed at MedGenome. So genetic counseling plays a very important role, because it is very important to understand what is the test about and what role it plays on your health.
Great. So I'm completely blown away with the information that you've shared, because I think there should be more and more of these conversations, and everybody should at least be aware of this predictive healthcare. And I think from what you said, I gather that the pre-counseling is the first step for anybody. After that, you can take an informed decision of taking the test and then the post-counseling. But I think the first step is for us to go through that pre-counseling with an expert, and not just the word of mouth and be misinformed, or to create myths around ourselves. So I'm going to shift gears here, Dr. Suruchi, and talk more about you now. Reflecting on your personal journey, I'm intrigued. What inspired you to pursue a career in genetics?
Yeah. So, well, Shreya, not basically in genetics as such when I started my career, but I'm from a very small place in Himachal, and myself, I'm a nature lover. So,
Mm-hmm.
despite of my simplicity of upbringing and scarcity of resources, but I was fascinated with intricacies of life, which is burned tightly within me. So basically, my father and my family was from a business background, and as a woman, like as a girl in a business family, it was very
Mm-hmm.
difficult, to make them understand that there is a life out of business also. And as we know in India, business families would marry their girls early,
Mm-hmm.
and they will. There is not much importance on the education part of the girls per se, but
Mm-hmm.
fortunately, my father was in service alone, and my father was in service, and he actually focused on our education a lot.
Mm-hmm.
And I was a bright child, I would say, and I could pick up things very well. So I passed my entrance examination for masters in human genomics and genetics. Mostly, it fascinated me because we as a family, I mean, I can share that, not a problem here. So we had squinted eyes in multiple members of our family. I myself had squinted eyes, and I was operated at the age of 6, and then at the age of 15 as well. My father was also having mild squinted eyes. My brother also developed it later. And then my grandmother was never operated, and she had those squinted eyes, a good squint in her eyes, and her siblings also. So, as a child, it always like fascinated me, like how can multiple members of a family be affected? So
Right.
when I was reading my biology books and growing in my education, so I just tried to ask few people, tried to ask questions to the doctors, and try to study myself about it. So I came to know that this is something which is inherited, and it inherits in a very specific fashion, that is like mother to son. So it's not like that parents are carrying something and all the children will have. So it is very specific manner in which it inherits, which is called as X-linked inheritance. So there are multiple patterns of inheritance when we inherit certain traits among our family members. Like it may pass on from only mother to son when it is X-linked inheritance, or if it is autosomal inheritance, it will pass from both mother and father to their children, and it can pass to daughters and sons both. So this particular squinted eye syndrome, or nystagmia, what we call, passes from mother to son. So that's how my grandmother was affected and my father was affected. And then from my father, I was affected. So it can be passed from fathers to sons and daughters both, but it will be passed from mother to son only. So when I was, getting married, and I actually thought that I may pass it to my son, but fortunately he doesn't have it. So there is a 50% of chance to carry it. So that is how genetics always fascinated me, and that's how I ended up doing masters in human genetics from Chandigarh. And it was very difficult for my father because we were three, and meeting the expenses of all the three of us living in hostels was difficult. We are three siblings, and my sister, she has done MBA in finance, and my brother is IITian engineering from Dhanbad. So all the three were in hostel, and it was very difficult. So I know, I mean, I have taught tuitions and done a lot of things to meet my expenses because it's expensive course as well. So, but then I could covet a gold medal in Masters in Human Genomics, and fortunately, with the efforts, I could pass. A national exam for which is called a CSIR exam, where you get enrolled for PhD and you get fellowship. So that was like a turning point in my life when I realized, okay, to study further, I will be paid. So that's the beauty when you do PhD, that government pays you some amount of scholarship which is tax free, and you do your doctor of philosophy, and you can pursue your career accordingly. So my father was kind of reluctant at that time because I got some opportunities abroad also and outside Chandigarh also in many prestigious institutions. I could pass my exam in the first attempt, and I've seen my peers not even passing for like 4 or 5 attempts. So that's how it was lucky for me. But my father had been reluctant at that time because there is a taboo in India, for girls, and he wanted me to marry soon because I was already crossing the age that they stipulated. But still, I could kind of pursue him, and I joined the course nearby to my home. Didn't go outside much so that he will be at peace, and could take it forward. Completed my PhD. And obviously, at that time, a lot of pressure of marriage every woman or girl would be having from the family. So same during my PhD only, my father had given me a deadline because my sister was getting married. And again, I mean, all the taboos which we know, I mean, elder sister not getting married and younger sister getting married. So I've gone through that also. So my father kind of, I won't say, I don't want to use a word, torturing, but it was really like, how can I get married before my younger sister, before even
Yeah.
completing my education? But still, I understood from his perspective, and found a match and got married. Just before 2 years, I completed my PhD after. And I would actually want to, appreciate my husband and his family, because they accepted it, and they told me that I can continue with my education after marriage as well. And there were times when my husband was not with me, I had to still stay to my in my institute to complete the education and complete the degree and all. So but I mean, giving on all the challenges, I could complete my PhD with good success. And then again, the another challenge after marriage is that you have to become a mother, and that also came, like for every woman it will come. So we were in Mumbai, and I was applying for postdoctoral fellowships. I had no choice to go outside, which everyone else would have gone, or my colleagues would have done has done basically, for
Mhm.
good postdoctoral fellowships outside India. I couldn't go for that for obvious reasons, but I joined ECTREC Mumbai for postdoctoral, and during that time, I was in a family way. I conceived, and I delivered a son, a beautiful son. And that's when I decided, like, it was a mixed of feelings, emotions for me, that how to get back to work, because it was just academic. I had finished, and I couldn't pursue my career in industry at all, or further in academics. So it becomes challenging after a gap of 2.5 years, to get back to the work. So once my son was like 1.5 years, I decided that now I have to go. Before that, I was really a good mother, took complete care of my son. But then I got opportunity in MedGenome labs in Bangalore when we moved to Bangalore. And there was no turning back after that. My husband was really supportive. He took 1 week leave because we didn't have any choice, where to keep my son if I am going for work. So just to figure out like how to manage, he took like 1 week leave. He said, "You join, you get comfortable. We will find out some ways," because our families were not ready to support, kind of, in the
Mhm.
sense they were. I mean, my uh, in-laws as well as my parents, they are in their own family comfortable, and they were like, for so much of salary, why you have to go out and work? You should
Yes.
better take care of your son. I mean, this is very truth, like what I'm telling here. And these are
Yeah.
the kind of, things which you commonly hear from families, like why
Yeah.
for such amount of money you have to go out and work. So I was like that, it's okay. It's not about money, it's about being myself, and I have to pursue my career, and I have to step out. If not now, then maybe never. So my husband was quite understanding, and he supported me, and I could kind of, uh, um, I mean, pass through this challenge as well. Um, Babies, they will get ill very fast if you put them in daycares. So that was also another challenge. Like till he became 3.5 years, every 2 months he was having high fever, viral fevers, and all.
Mhm.
But
Mhm.
then after 3.5 years, the journey became very smooth. He also understood, and everybody understood. And here I am. Even MedGenome has given me like lot of opportunities, lot of leverage. I want to thank my mentors. And I mean, this is only like, at this point, I'm full of gratitude for
Mhm.
my family, for my husband, for my mentors, what I am today. And
Mhm.
the message that I want to pass on is that once you decide, there is no turning back. Whatever the challenges may come, there will be a way to themselves. I mean, there is nothing that can stop you if you have made up your mind, because the way will be shown as you move.
It's really heartwarming to hear your personal journey, Dr. Suruchi. You made the most of whatever resources you had. And I'm sure a lot of our women listeners will relate to your story and challenges. But I particularly love the part that in your entire story, you never projected yourself as a victim. You rather always focused on getting better at your abilities. So I think that's the message for all of us that, the challenges will be there. And I'm sure it is there. These challenges continue to exist for different genders and different shapes and forms, but we need to focus on what is in our control and take charge of our life. So, Dr. Suruchi, I also wanted to understand how have you observed the landscape of STEM evolve for women since you embarked on your journey, on your career more than a decade ago? And any specific advice would you offer to young girls who aspire to pursue careers in these sciences?
Sure, sure. This is a very important field. STEM is an important field, and all innovation and advancements which happen through STEM have direct impact on people's lives. And therefore, it is very imperative that both men and women should be equally part of this field. Women have been joining STEM fields. The bias is definitely there, but it has improved over a period of time. Statistically, if you see, women in science and engineering is growing. However, men continue to outnumber. Uh, this may be due to like gender bias, unequal opportunities, especially in leadership roles, and work-life balance issues. Nonetheless, there are opportunities and efforts being made to address these gender disparities in STEM. Like parents have become more aware about their girl child and they provide equal opportunities for their education. Government led education programs for girls and female health and female education being promoted through various platforms.
Mhm.
And there are initiatives at the work level to promote diversity and inclusion, like some mentorship programs, policies which support work life balance for women. There are certain increased opportunities for women in STEM at each level in the
Mhm.
last few years. And advice I would like to give to girls who aspire for career in sciences is that they should pursue their passions. They should choose the fields that genuinely interest them. You should be more careful in identifying your interest and then pursue it. So this is one advice, like according to your strengths and values, you should build a strong support network. And I mean, it's like, seeking members and peers who can provide the guidance and support along your journey. So seek mentors and peers who will support you in your journey. Be resilient, overcome the challenges. Like you said, that I was never been a victim of anything that came into my way. So we don't have to be the victims, but we have to overcome the challenges
Mhm.
which comes in our career path, and we have to this basically perseverance through the setbacks. Setbacks will definitely be there, and there will be pullbacks. There will be a lot of thoughts. There will be a lot of emotions. There will be a lot of physical taxing because of your work at home and work at profession. But we have to overcome the challenges. We have to keep our mind strong and pursue it. And we have to advocate for ourselves. We don't have to be afraid to assert ourselves and advocate for our advancement and opportunities. And of course, we have to embrace the diversity also.
Thank you so much, Dr. Suruchi. More power to mentors and achievers like you for the women out there. And going back to our previous discussion, what advice would you like to give for women for preventive healthcare?
Definitely, especially, women who are nearing 40 years of age, it is very important to take care of their health given the risk and prevalence of women cancers or diseases that women may have. Because again, I would just like to highlight a point here that, we as a women, we always think about our family, about our children first, and we think about ourselves like it is, we just don't take care about ourselves, even if we are aware. For example, if I take myself also, even I am aware of so many things, I'm not able to pursue my mother to go for a regular health checkup, or my family to go for a regular health checkup, because they are not brought up like that. Their mindset is just that it's okay, jab aayega tab dekh lenge, or I mean
Right.
when it will happen we will see it at that time. So that kind of attitude should not be there. We should be aware of our body, aware of our health, and especially when we are nearing 40 years of age, it is recommended that we should go for regular health checkup, which should include breast scans and pap smear test and certain other tests, so that the risk of developing any disease which may be a burden for your family or for yourself later on can be avoided. Not only we should think about, cancer risk or big diseases, we should even think about our bone health and our day to day, how we are aging, or how we are, when we are above 40, our bone health goes for a toss, so we have to take care of ourselves in that sense also. So simple
Mhm.
vitamin tests or calcium tests or iron tests are also very important to undergo on a regular basis, so that we can be healthy and keep our families and our surroundings healthy.
Lovely. Thank you so much, Dr. Suruchi, not only for decoding genomics and predictive healthcare for us, but also sharing your inspirational journey as a woman of STEM. At TOSB Conversation Starters, we strive to spark a new think with some interesting topic and eminent people. If you have an interesting think, reach out to the Outstanding Speakers Bureau. We'll be back with yet another thought provoking episode. Till then, this is your host Shreya signing off.